Thank you very much for being with us this evening, Mr. Masebe. So the third wave is officially upon us now. Looking at figures from yesterday, 13th of May, there are currently roughly 17,500 active cases in Gauteng, with 1,533 hospitalizations across the province. What did these figures look like compared to the height of the second wave?
Well, obviously, it's early stages. The height of the second wave, we know we got figures in more than 6,000 or close to, or actually it was the highest was 7,000. Now we have seen in the past 2 days in a row, the number of new infections was over 1,000. So we are really worried. We have seen a consistent rise in the number of new infections. And as we compare week by week, we are also seeing that consistent rise.
Which areas of Gauteng are showing the most new cases?
Well, mostly Tshwane, Sidibeng, and some parts of Johannesburg.
Based on the figures, when is the province likely to reach the peak of its third wave?
Well, I won't know when exactly we will reach the peak, but we can see a clear pattern that the numbers are going up, and in fact going up rapidly. As I said, in the past few days, 2 days in a row, we saw the numbers of over 1,000 new infections a day.
Let's talk about the readiness of health facilities across the province to deal with this third wave.
Well, health facilities remain ready. We have increased the capacity in all our hospitals. So we are confident that should people fall ill and need hospital care, we will be able to care for them in the hospitals.
Specifically in terms of PPE, we had seen during the height of previous waves that despite the province saying that we had been ready, there was a shortage of PPE, with some health workers wearing black plastic bags instead of, provided PPE aprons, reusing gloves and masks. Are we ready now in terms of the number of available PPE?
No, actually, to correct that, in Gauteng, we never had a problem of PPE. There may have been a problem of distribution, but we always had sufficient stock, sufficient supply of PPE in all the hospitals and other facilities, such as community healthcare centers. So now we have made sure that the PPE does reach the people who need to use it as and when they have to. So there is enough supply of PPE, and we'll make sure that all our health workers have access to it.
While infections are rising, we look to the vulnerable above 60 years of age who are next on the list to be vaccinated. How are digital registrations going so far in Gauteng?
The registration is going well. We've seen an increase in the numbers. They started slowly, but now they are really going up. We are nearing 300,000. Actually, more than 300,000 people have already registered on the system, and we continue to monitor it. But in addition to that, we are also sending out health workers, community health workers, to all the areas to assist those elderly who are unable to register themselves, so that they can be registered to get vaccinated when we start with the second phase of our vaccination next week.
Previously, the mining sector contributed a number of COVID-19 infections. Tell us about the new hospital in Carletonville, which was commissioned to assist mining communities during the pandemic.
We are happy that the new hospital is now ready to operate. The Premier went there today with the MEC to officially open the hospital. So this will also add capacity so that we're able to care for people who need hospital care.
Great. Thank you very much for taking the time to speak to us. That was government spokesperson Thabo Masebe.